Hi, good afternoon, and thank you for joining us for another one of our community sessions. We are going to talk more about managing stress and managing some strong feelings. Last time we spoke about meditation. It was a guided meditation that I was taking you through, and that's something that is good to regulate us emotionally throughout the day. It's good to do it every day. It's good to do it at least once per day. So we are kind of helping our body and our mind to regulate better emotionally throughout the day, especially when there is a high stress. This time, what I wanted to show you some tips of how you can reduce the levels of stress while they're already up. So, for example, something stressed you out, there was a fear, and this fear triggered an feeling of anxiety, and you find it difficult to go back to the base. Normally, what's happening with fear, with typical fear, you feel fear, and the stimuli that cause the fear goes away, you relax, you do something, you move away, and it's gone. But what often happens is that the fear then triggers the ongoing feeling of anxiety, and it's difficult for us to then regulate ourselves. So I'm going to show you a few techniques to do exactly that. So this is not only used for fear. I use this for pain management, for example, some of these techniques. It can be used for any strong emotion, for anger, for intense sadness, all of that can be used and regulated with these techniques. But what we are talking about today is more of this anxious feeling that doesn't go away once it's triggered. So, first exercise, and my favorite, not exercise, sorry, I'm a physio, so exercise comes to mind a lot. The first technique, the first tip is hard breathing. And you probably heard me before we did the meditation one last Tuesday. I started with hard breathing, but there we go, just using the hard breathing because it's so powerful. So what I need you to do is put your either hand on your heart, and you can close your eyes. It's usually useful to close your eyes. And so if you're doing it with us on your side of the screen, just do that. You can sit, you can stand, you can, this doesn't take longer than a minute. Put your hand on your heart and imagine that you can breathe through your nose all the way into your hand. And you don't need to control your breathing. You don't need to breathe any deeper or slower or any. Just breathe as you're breathing normally into your hand. What you're doing just now is you're syncing, you're putting into sync your mind and your heart. Usually what happens when we are in very strong feeling, we get out of sync. So what we are doing now, we are connecting our mind and our heart. We are creating another rhythm. It's called heart-mind coherence rhythm. And you might have already noticed that you're breathing deeper and slower, that your heart stopped racing. And the research has shown that doing this only for 1 minute will do the trick. So it takes a minute, probably even less than a minute, for your mind and heart to start working in one rhythm, working as one. And when you're ready, you can open your eyes. How did that feel for you?
Yeah, it feels calm.
Calmer, yeah.
Calmer.
Yeah. And I've used this for. It's strange to open your eyes now, isn't it? Bright light. I use this also for with some patients to reduce blood pressure. And in 1 minute, it reduces blood pressure to around 20 points, which is quite powerful. The other one is just simple exhale. So what happens is when we are, say, in a state of high anxiety or even close to the panic, our breathing changes. Our breathing is very shallow and upper chest breathing, and it feels like we can't catch a breath. And then that increases the feeling of anxiety because it's actually very scary to be in that one that you can't breathe. And what we are trying to do in that moment is to breathe in. And that is quite challenging. Lots of people find it quite challenging because, if I could just breathe in, all that would stop. So the technique is actually to exhale, to breathe out, to not to try to breathe in, but to actually get all the air that you have in your lungs out. Because the most normal thing after what your body does after exhale is to inhale. So instead of trying to force an inhale, which is quite challenging and difficult in that moment, what you do is you actually exhale, and then naturally your body will inhale. Yeah. So you just go, and then your body inhales on its own. There is no need to use muscles. There is no use to force it. It happens on its own. So you basically force exhale instead of inhale. The third one is bilateral stimulation. And it sounds very, medical maybe even, but it's really nothing but tossing the ball in between your left and right hand. So I'm just going to pick up some balls here for us. Which one do you prefer? Okay. So what's happening when we are experiencing strong feeling of fear, or actually rather call it an anxiety that doesn't want to go away, or it blocks you in some way, is all of that emotion we've seen on MRIs is that it's happening in small part of our brain. It's happening in one small part of the brain. Is just like a cluster of neural activity, and it's just growing and getting bigger. So what is useful to do is then engage, and it's happening in one brain hemisphere. So what is useful then is to engage the other brain hemisphere, so left and right, to kind of what would be the word for it? To water it down, to dilute that intense feeling of fear. I don't know, for me, it's kind of liquidy. So what we do, we engage different systems. We engage arms. The rapid eye movement therapy is using a similar thing. We're engaging eyes, but doing it in a context when we are doing it ourselves is not so useful. So not so easy to do on our own. So what we do, we want to toss something in between left and right. So if you were, for example, right now, you're feeling relaxed because you did your breathing. But if you were to think about something that really feels anxious for you, can you feel it right now? Yeah? You feel it? You have something in your mind that makes you feel anxious.
Yes.
And on what level would that intensity be?
Like for now, like level 1 or 2.
Okay,
like,
can you crank it up a bit? Can you give it a bit more? Think so what we normally do to increase feeling of something, we think some more about it. More you feel about something, more intensity that emotion has. So somewhere about 4 or 5.
Okay.
Yeah.
Okay.
Can you feel that intensity?
Yes.
Yeah. Okay. So what I need you to do is you can still think about it, but just take this ball and go in between left and right. and just toss it. You don't need to look at it. You can look at it,
Mhm.
but you don't need to look at it. So you engage your eyes. So what's happening here is that we are reducing the intensity, the cluster of that brain activity in one part of your brain. And it has to be from left to right. You cannot just do it in the middle, or you can do it once. So it needs to pass the middle of your body. And now when you think about that thing as you're doing it, how does it feel?
It
Feels better.
feels better.
Yeah.
Yeah.
Where is the intensity now?
It's getting lower actually.
Yeah?
Yeah.
Huh?
Feel quite more comfortable right now.
Yeah, yeah, yeah. It's interesting how these
Yeah.
small things, you can have your keys. You can do this with your car keys. You
Yeah.
can do it with a bottle of water.
Mhm.
You can do it with a pen. We just so happen to have these nice balls here. Yeah. So that was bilateral stimulation.
Mhm.
4 is open focus exercise. This exercise is actually really good for lots of us that are working indoors a lot, they're not spending lots of time outside, so that it's actually helping to relax our eyes. But what does it do is, again, because anxiety is happening in one small part of our brain, and it's very intense over there, we are doing all these things. They're different techniques. They're basically doing the same thing. They are reducing the focus, reducing the intensity of the feeling and intensity of the reaction, neural activity in our brain. So what you do is you can do it as I'm saying. You focus your mind in some distant point further away, and just focus your eyes, to that spot, and look at that spot, and then don't let your eyes wander around. Just put all your attention and focus on that spot. And as you're focusing on that spot, you're then at the same time looking and focusing at that spot, but then including a bit more of the focus to the left and to the right of your position, and widening that focus, seeing just next to you, but at the same time looking at that spot at the same time. And then, as if you can imagine that you can see all the way 360 degrees all around your head. And what would typically happen is that at one point your shoulders will just drop. I don't know if you notice that happening with me.
Correct.
It's a sensory overload. And that also helps to reduce the feeling, the intense feeling that we feel in our body. And as I said, it's very useful to do that for any type of strong emotion. And the last one, I think my energy is going down now. It's showing you. I'm actually very, very relaxed. Backward spin, strong emotion. So what happens with, as I said on the beginning, fear is the emotion that moves and usually moves through our body and goes out. But with anxiety, it is the emotion that stays in our body. It's kind of feeding itself, and it typically moves in a loop. So we say it spins. It can spin this way, it can spin this way, it can spin this way, that way, any way. And it can be anywhere in the body. So what I'm going to ask you right now, when you're thinking about something that makes you feel anxious, can you tell me where is it in your body? So you can close your eyes. It's easier to think about. Where is it in your body?
So usually on my head and my stomach.
Okay. So it connects your head and your stomach.
Yeah.
So how does it move? Does it go from the stomach to the head, or from the head to the stomach?
Yeah, right now from head through stomach.
Okay, and can you show me how, with your hand, you can use your hand, you can show me, so head, stomach, how does it move? And so it goes outwards and then up and then goes inwards. Okay, good. So now allow yourself to feel it a little bit and keep your hand moving. It's easier to do it with a moving hand. Just where it is, just follow the movement of the feeling. Okay. Okay. And now spin it other way around. There we go. Okay. So what I've noticed happening right now is that you started breathing deeper. Your breathing pattern changed. What else changed?
Yeah. The anxiety level gets lower.
Yeah.
And more calmer.
Calmer, your shoulders go down. Yeah.
Good.
Okay. Sometimes it looks like it's a straight line going up and down or left and right. But if you notice, just notice, is it going a little bit outside and in or inside and out? And then you will see that it's a loop. And then you can do it with your hand. It's easier that way, especially when we're doing it for the first time. Or even for me right now doing it, I like to do it with my hand. It's easier to engage with the feeling and then spin it in an opposite direction. And none of that takes long time. All of these exercises are, less than a minute, and you can do them anywhere. Yeah, especially this one. You can toss wherever you are. You can stare in a distance wherever you are. Exhale. Sometimes my patients will ask me if I'm tense, if I'm doing certain treatment that makes my body feel more tense, or I'm more focused into doing something when I'm doing dry needling, or for example, after I'll go, and even just doing that exhale helps and release the tension in the body. Yeah. Do you have any questions?
That's it. Yeah.
No?
It's a good, it's a simple technique, but it helps a lot.
Yeah. Yeah. Yeah, and you don't need, some people prefer certain things. Yeah. Some things don't work for some people. So you find what works for you and then you do that. Feel free to write them down in the comments or in the video that comes out later on. And I will be happy to maybe then go deeper on some of these things in the next session on Tuesday. Or if you have any preferences, anything that you would like to hear about from us, feel free to write us. And please join our community on WhatsApp. I think that the link is in the bio. Thank you.